All right. So thanks for inviting me to give this talk. I hope that it builds on Dr. Gallagher's talk from last month, where he provided an excellent overview of mental health and its evolution over the years. But this is particularly going to focus on Civil War era 19th century mental disorders and how they were understood and how they attempted to treat them during that time. So today I'm going to briefly review the 19th century understanding of mental illness and its causes, which is, as probably anticipate, very different from the way we understand them today. Then I'll describe some of the kinds of physical and psychological trauma that soldiers experienced during the Civil War. I should mention that soldiers were hardly the only people to experience trauma during wartime in general, and during the Civil War, there were many civilians, enslaved persons who experienced quite a bit of trauma and displacement, but I'm mainly going to focus on the soldiers just because that's where the studies are. And then I'm going to talk about the modern day diagnosis of PTSD, the way we understand it, and the way we currently manage people who are affected with it. So what do you think about when you hear the term Civil War medicine? So I've taught a course at Georgetown for a few years, an elective for first year medical students, and usually when they come in, they're thinking about images like this. So on the left, we've got the images of the mini balls, the special kind of ammunition that was easier to fire and was more accurate at long distances, but unfortunately caused a lot more damage than previous projectiles from firearms were, and leading to a lot of the physical injuries in the war. You can see on this side, on the right side, the surgeon's toolkit, including the saw used for amputations. That instrument actually was probably used more often than most of the probes and things in here. And then down over here is an image of a stethoscope. I actually took this at an interesting St. Louis Civil War museum. And you can see the stethoscope and also some bottles which contain different types of things that were given soldiers with different medical illnesses like diarrhea or nausea or other things that were not directly caused by battle. So usually we think about these things, but we don't really think about mental health. And there are a lot of very good histories of Civil War medicine. I recommend any of these books. Like they're all excellent. They all each have chapters on things like surgery and nursing and infectious disease. What they don't have is any chapters on mental illness. Like it's really mentioned only in passing. It wasn't something that was well documented during the war, which is probably part of it, but also the lack of understanding of mental health necessarily being connected to the experience of war. Obviously, if you're shot, then you know that was directly connected to war, and any injury, physical injury and infection and things like that would be directly connected. But the way that people acted, behaved, their personalities, that wasn't necessarily thought to be related to what was going on in those 4 years. And that may seem like a really naive thing, but it was, it really is more of a modern day thing to connect trauma from war with mental symptoms. So fortunately, there actually is a good recent book that came out just a few years ago called Invisible Wounds. And I think that's a great title because these were not things that were visible. You couldn't look at someone and say, where are you hurt? There's the common, very common experience of the soldiers being shot instantly want to pull away that part of their clothing covering whatever that part is to see if they were shot. But these were not things that you could actually see in somebody. But nonetheless, these illnesses certainly did exist both during and especially after the war, and are only increasingly being recognized kind of today. And I'm going to talk about a few studies that look back and tried to document the burden of mental illness during this time period. So what were the major causes of insanity? According to the 19th century physician or psychiatrist, although I don't think that name actually existed as a medical specialty at that time. And it was really based on what was like these moral theories that if you were insane, that you had done something wrong, like whether that was masturbation or whether that was excessive use of alcohol. Hereditary influence doesn't tend to necessarily be connected to morals, but often, something that there would be something bad that that the father would do, that it was inherited by the son. They were and any chronic physical illness was also thought to contribute to insanity, but especially sexually transmitted illness because of the moral ramifications of that. We do know today, obviously, that syphilis, untreated for a long time, can cause mental illness, but many other sexually transmitted infections were also thought to cause insanity, or the definition of that. Also, just things like financial setbacks, which also had a moral cast. Like if you were failing in finance, you must have been doing something shady or something that wasn't above board. And also marital problems, which were also largely, blamed on, rather than, incompatibility of a couple. It was just something that the husband or the wife was doing wrong, or behaving wrong. So all these things, this is not an exclusive list. There are other things, but these are the major things that sort of come up time and again when they talk about insanity and its causes. It's hard to boil down the experience of soldiering in the Civil War and soldiering in general. But I think compared to modern day wars, there's some things that were very different about this. So first, this was the first major war the US had gone through since the Revolutionary War. Now, obviously, there was the War of 1812, there was the Mexican War, but those were relatively short and relatively small numbers of soldiers were involved. Um, at the start of the Civil War, volunteers on both sides just thought this would be this glorious thing. We'd go in, it'd be short. We had to like get in before the war was going to be over. Abraham Lincoln ambitiously only enlisted soldiers for a 90-day time period initially. And soldiers didn't really think about getting injured. I mean, obviously that was a theoretical thing, but they sort of thought, oh, well, that's going to happen to somebody else. The first Confederate Secretary of War, who had no military experience, actually had this infamous comment that he made before the war started, that he felt that all the blood that would be shed as a result of secession could be contained in a handkerchief, which was ridiculous at the time. And even if the war had lasted less than 90 days, it probably would have been more. But that was like really the thinking. There weren't a lot of people with the experience of war. Those were mostly Mexican War veterans, and that was a very small number of troops. It was a very small standing army at that time. So very few, especially of the common soldiers, the privates, like really understood what they were getting into. The other thing that became less common compared to prior conflicts, but still was important, is that medical illness was much more important in mortality than battlefield wounds. In Civil War, the ratio was only 2 to 1. In previous wars, it was even higher than that. It wasn't until much more recently that, because you brought in men from all over the country, they had different types of immunity. Some were immune to others. They all got sick. They all got the measles. They all got like very contagious things, and they were living in these really unsanitary conditions. They were fed on this diet of like hardtack and not enough vegetables, and meat of dubious quality. So you have, people who had low pre-existing immunity, not great nutrition, not really understanding contagious diseases. Early in the war, they would dig outhouses that would, dig trenches for people to defecate in, and they were fed, like they leaked into the water supply. Like they weren't even sort of familiar with the fact that you need to separate those things until later in the war. So this was something that was going on regardless of fighting. But when they were marching, they would march up to 25 miles a day. They had terrible footwear, or maybe they didn't have footwear. The uniforms were really heavy and warm. If you go, most of the battles are fought in the summer because that's when you could march around and without obstacles. In the winter, mostly you didn't fight, but you wore these heavy uniforms that'd be more appropriate for December. They carried these very heavy packs, and they didn't get enough to drink. So these are all things that mediated against the soldier before they were even in battle. And in battle, the experience, this is just something that came out of the Dylan Carroll book that I thought was especially accurate. Soldiers were choked and blinded by smoke. The roar of their muskets deadened their eardrums. They weren't wearing any kind of noise protection, and they were pelted with clods of earth, splinters of wood, shards of rock, pieces of animal, and sometimes human remains. Just a horrible experience, something that would seem like I would think would be traumatic 100% of people, but actually many of the soldiers did emerge from the war without suffering from any of the things that I'm going to talk about. The other thing to be aware of is that the scale of death and injury was just so much higher, even compared to the Revolutionary War deaths. So in 7 years of the Revolutionary War, less than 7,000 people died. Sorry, less than 7,000 soldiers died on the American side in 7 years of countless battles. Whereas at the Battle of Antietam, which was the bloodiest battle, a single day battle of the war, in 12 hours, more than half that number died. In two battles, he probably exceeded all the deaths in the entire Revolutionary War. This was not something people were prepared for. The medical establishment, the doctors who were serving the armies, the Surgeon General, nobody was prepared for all that, and it really took a couple years before they started being able to just evacuate people after the battle was over and bring them to triage stations and actually organize hospitals that were large enough to take in all the people who were physically injured. When you think about the Civil War, those of us who are Civil War buffs, I do consider myself a Civil War buff. Often there are these maps, and you're poring over these things with arrows to show where the armies traveled and where they intersected. And these are very sterile. They don't really capture the impact of. On the right side, this is the Battle of Chancellorsville, which was a battle with horrendous casualties, mostly remembered for a unorthodox maneuver, splitting your inferior army in half, and swinging around and launching a flank attack. But these were, but in the first few years of the war, like most of your time was actually not spent on the battle, like on the actual battlefield. There were big gaps between each battle, and so I kind of went through. So there were, after a fight, like the armies in the first few years of the war, at least, would retreat. They would lick their wounds. They would, treat your casualties. They'd reorganize, regiments that had a lot of people either wounded or killed, like might be merged into other regiments. And there was lots of time. You can see from the first battle of the war to the 7 days, which was really the next major battle, there was almost a year in between. So a long time. Even when the things sort of picked up a little, you're still looking at least 3 weeks, sometimes months between these huge battles. So there was really time to recover, time to kind of process if you were a soldier, all the carnage and terrible things you'd seen, time to sort of forget honestly about some of the trauma, and be able to muster that effort, in the next battle. This went on for about the first 3 years of the war. Um, from the Gettysburg campaign, the famous Battle of Gettysburg, of course, in Pennsylvania, to the Wilderness, it was almost a year, but that ended in 1864. So in 1864, a general took over named Ulysses Grant, and he had a different idea. And he said, like, the way that we win this war is not by fighting these battles and then retreating for months. We're just going to fight them and fight them and fight them and just keep fighting them until they just want to give up, or they just don't have any men left. And so, whereas the previous battles had lasted no more than 3 days in duration, the overland campaign, which began around Fredericksburg but ended up like around Richmond and Petersburg, was 40 days of virtually continuous fighting and marching. No time to step back, lick your wounds. Between each of the discrete battles, there was 1 or 2 days, or at most 5 days. And the Battle of Spotsylvania Courthouse alone lasted 12 days, and they're fighting for most of that time. So there are massive numbers of casualties. There are more casualties here than in probably the first 3 years of the war, just because of the strategies that the Union Army was leading to. And you can see these massive numbers. The armies began with about 120,000 Union, about 60,000 Confederates. So they were decimated by this. They were not only by death, but by people with amputation who were permanently removed from the war. And so many of these soldiers did not return to the battlefield, but they still were suffering the consequences of this campaign. And just coincidentally, I was at Spotsylvania Courthouse, which was one of those battles. And this is just a shot from what's actually a very peaceful and beautiful area these days. But in 1864, May 1864, it was the site of one of the most terrible battles of the war. One of the famous things of that battle, you can kind of see it on this roadside thing, is there was a tree that was literally cut up by, there's so many bullets hit this tree, it was sort of carved up, and there's just only a little point to it. It was like somebody sawed it down, except it was just really bullets that did that. And that tree is actually on display in the Smithsonian. Just to magnify, and this is just the words from the thing, for 22 hours, combat raged on the landscape, right in that focused area. Even though fighting extended for half a mile, this was like basically where it happened. There was sustained close range fire. I mean, they were firing point blank into each other. The Union was trying to storm the works. The Confederates would shoot them down. The Union would send in more people. Men were just torn up, and some were so mutilated they couldn't be identified except by the color of their beard or something they pinned to their jacket. It was kind of unimaginably bad. And the survivors, you can just imagine kind of the impact of witnessing all this, and how how do you even process this and relate it when you go home, and and your family asks you, like, about your experiences. So right here, I wanted to pause and actually show you about a 7-minute clip from a different webinar from the National Museum of Civil War Medicine, which incidentally is one of the best, probably the premier museum of Civil War medicine, just in Frederick, Maryland, where they talked about mental health issues during the Civil War. And you have the speaker sort of talking about the impact, especially of the later stages of that campaign around Petersburg, where actually the campaign ground down and became a siege, and it was no longer kind of the pitched battles. It was more of just kind of waiting out, but still with the kind of the anxiety of trenches, and if you stick your head up, you might get shot and things like that. So I'm gonna stop sharing my presentation for a second and go into that.
Was ready for the challenge. The early exuberance of the war quickly dissolved into abject misery and a constant assault on the human body and mind. The troops were severely stressed because of abysmal food, constant marching, rarely having a decent place to rest, and seldom a chance for a furlough. There was, of course, rampant disease, and again, that unremitting, intimate violence. In June of 1864, Captain H.L. Patton of the 20th Massachusetts describes the state of his troops at that point in time. He says, quote, "The men have been so horribly worked and badgered that they are utterly unnerved and demoralized. They are easily scared as a timid child at night. You had a campaign of 1 day, we of 53 days. Every night under fire, every night either digging or marching. For my own part, I am utterly tired and disheartened, and if I stay at all, it will be like a whipped dog." The mental toll on the troops was enormous, but neither the medical staff nor military leadership had any understanding of why morale, discipline, unit cohesion, and readiness were breaking down. The strain placed on the troops resulted in nearly 300,000 desertions. Some were so desperate to escape that they shot off fingers and toes just to get a discharge. During the war, both the Northern and Southern armies used the medical diagnostic system that had been developed by British Dr. William Farr. This classified the diseases of the patients, but the system did not include mental disorders. But nonetheless, dealing with the mental health issues still was going to be the responsibility of the medical staff. We really have to be fair to those people. They already had their hands full just trying to deal with physical injuries, and they themselves, nurses and doctors, were experiencing the same psychological symptoms. An estimated 10% of the nurses just collapsed. Many physicians either collapse, they posted to less strenuous duty, or they self-medicated with alcohol to deal with their own trauma. Now, alcohol abuse was also a very well-documented coping mechanism in the officer corps. We know that 17 Federal and 10 Confederate generals were either dismissed from service or seriously injured their careers due to the overuse of alcohol. And likewise, suicide was rampant in the officer corps. When you get in and start reading firsthand reports and letters of the day, it soon becomes very apparent that Generals Richard Ewell, George B. McClellan, George Pickett, Gouverneur Warren, and John Bell Hood were all relieved of duty because of the behaviors that we know now are textbook PTSD. In August of 1864, an aide to General Ulysses S. Grant said this, quote, "Grant is not at all well, and there are fears that he is breaking down." Indeed, he was, because unremitting stress degrades the immune system to such a degree that the victim is essentially committing emotional suicide.
Sorry about that. All right. Give me a second to reshare. So, so she mentions the term PTSD in there, and of course, that condition didn't exist or wasn't named that at the time. But there were some other expressions used that may refer to some of the manifestations of PTSD. In particular, soldiers sometimes caused, or this would be something where officers refer to soldiers as played out. And then what that meant was that the stressors of war had led to exhaustion, both physical exhaustion and also just emotional exhaustion, where they were literally unable to conceive of doing their duties. This happened actually at after the Battle of Cold Harbor, where there was a unfortunate Union charge where about 5,000 soldiers were wounded in the first like hour of fighting because they were going up against like incredibly strong built up defenses or works on the Confederate side. Soldiers just refused to do it anymore. They were just like, you know, we're just not going to do that. Their officers would order them to get up and attack, and they would just sit there or lie down because they just couldn't do it. The other term that was used was nostalgia, which to us refers to like good memories generally of the past. But what it meant in the 19th century was severe despair, homesickness, leading to basically the person just losing touch with reality, not eating, just being completely listless. And this, unfortunately, was considered a moral problem. It was that the person had a feeble will, and the way to treat it was not to coddle the patient, but actually to throw them back into battle, drilling them, shaming them for like you can think of the retreating soldier where the general is like getting out his sword and hitting them with the back of his sword and telling them to turn around, sending men straight to the front lines because that'll snap them out of it. And unfortunately, this persisted not just in the Civil War, but all the way through to World War II, where there are some examples of, in particular, in the European theater, General Patton getting furious at people who were suffering mental breakdowns because they didn't have any physical injuries. So even though at that point, like he was actually censored, and because there was some understanding of how this was a debilitating type of illness, just as much as having your legs shot off. I don't want to leave you with the impression that soldiers couldn't cope. Like, actually only a minority of soldiers, even by the most loose definition, probably suffered from PTSD. Many of them were able to process the trauma of the war, and there were some active coping strategies that they used. One in particular was religious faith. Some soldiers came into the war with very strong religious faith. Some had no religious faith. Some were somewhere in between. But there are lots of examples of during the war where there were these big revivals that happened when the armies were camped out and just sort of waiting for the next battle. Many letters written home would talk about how they kind of recognized that their lives were not under control, that they were they were kind of reconciled to whatever God had in store for them. This was primarily, of course, at the time, Christian religious faith. But it's something where many of the generals too, like we're sort of talking about, is they kind of the outcomes of the battles maybe weren't under the control, but this filtered all the way down to the kind of the lowest ranked members of the armies. Straggling and shirking. So this was when your army marched somewhere and you sort of, instead of being in line on the march, you'd sort of fall back. Maybe you'd even disappear for a little while. And then eventually you'd get back to the army. This is not the same thing as going AWOL. And sometimes it was just due to the intense physical demands of a march. Like if it was 90 degrees outside, you're marching 30 miles that day, and you get dehydrated and tired, you'd have to stop. You couldn't go any further. But these were men but this was also done and was more common in men who, it was sort of a way of coping with the trauma. Like you sort of a little bit of rebellion, but not something that would necessarily get them in trouble. There was a lot of camaraderie, a lot of soldiers, who understood what they each had gone through, sort of bucking each other up. And of course, letter writing home was an essential lifeline, knowing that there was some meaning to this, that you had loved ones at home, particularly if you were defending something. I'm sure that the Union Army, the people defending Pennsylvania when the Confederacy invaded, similarly when the Confederate territories were invaded by the Union, like they kind of recognized that there was a greater meaning behind all this trauma, and it wasn't a meaningless thing. And because once you started feeling like it was meaningless, that's really where the descent started to begin toward mental injury. Of course, there were also bad ways to cope with war trauma. One way that we talk about very much with PTSD is emotional desensitization, kind of hardening. Like, you would no longer feel empathy for the person who was wounded. You'd actually make fun of them. Like you'd have gallows humor where you wouldn't feel anything because this sort of protected you. Another way was to dissociate from it, kind of like step outside of your body and saying, like this happened to somebody. It didn't happen to me particularly. And that was a protective way. It was in the moment, it may have been protective, but it was certainly very very not protective once the battle was done, or once you were going home. If you acted this way, your family couldn't get in touch with you because you put up this wall. And of course, alcoholism, as the speaker mentioned, was a very common response. There was, of course, there was some knowledge that it wasn't good to be drinking large amounts, but it was one of the few ways that soldiers had to unwind. So how often did this happen? So the only real good study of this, which was actually based on medical records of the war, looking at the Union side, was a study that was just done like in 2012, where they actually looked through these old archives, said, well, how often did things happen? How often were people committing suicide? And this was just during active duty. This was not afterwards. And there are indications that suicides actually happened most after people had gone home, when they no longer had the war to kind of occupy them, and they were processing this, and they were processing it in very negative ways. Although it is interesting to note that the year after the war was over, when a lot of the men had already gone home, these were the soldiers who were still who had, I guess, enlisted late in the war, and they were still on active duty. The suicide rate rose a lot more, and you can actually see that in the war in Iraq, and probably in the wars of Afghanistan, but I know in particular in the recent war in Iraq, most of the suicides occurred in people who had never been exposed to battle, but people who were like serving on the back lines, and it wasn't that they were. It wasn't necessarily all just the trauma from witnessing it, but even kind of loneliness and being somewhere unfamiliar and being isolated, like, also led to problems. We believe that the documented rates are very low estimates. You can see the highest percentage was like of nostalgia was 1 in every 300 soldiers. This seems ridiculously low, and probably is just because there wasn't a whole lot of incentive to report this. I mean, what were they going to do for you? They if they're going to send you to the front line because you reported nostalgia, you're not going to report nostalgia, or if insanity was going to make you branded as, oh, well, this guy has a moral problem, then you weren't going to report that either. Inebriation, as distinct from chronic alcoholism, again, like, these are very, very low figures, but it was kind of what was recorded, and maybe says more about the the stigma of having these conditions rather than an accurate estimate of what the real prevalence and incidence in the armies. So those of you who were on the webinar last month, this picture will be familiar because it actually is the same picture of St. Elizabeth's Hospital. This is the insane asylum, the official insane asylum for the Union, for the North, where soldiers from all over the North who were suffering from insanity during and after the war were sent. And the types of therapy they received were very different from what you would see in a psychiatric ward today. Of course, there was rest. The feeling was if they did something productive with themselves, so it could be something like gardening, but it would kind of help bring them back. And they also administered a variety of things. Opiates were a very popular thing to administer. Opiates, up until the early 20th century, were considered the solution for everything. Like they were in Coca-Cola. They were, and so during the war, like this was they were given in something called laudanum was a common product, also used for pain control. Stimulants and also tonics, and those really varied in their contents. But I found one recipe, and it milk, eggs, sugar, and whiskey. I'm not sure how that would. I'm trying to think if that would like affect somebody positively or negatively, but it was given. And then, basically they lived there, and if they seemed to get better, then they were sent home. If not, they just kind of lived here for the rest of their lives. Most of them did not get better, unfortunately, but so they were kind of housed in places like this. This was not the only one, but it was one of the largest ones that we know of. So a few case studies. These come out of Carol's book, and I wish I had pictures of these soldiers, but I don't. So you just have to sort of imagine what they look like. And so Union veterans, the African American veterans were not allowed to serve until 1863, and mostly not until 1864. So in the early years of the war, when I'm talking about a Union veteran, it's generally a white Union veteran. But I will talk about an African American veteran. But this was a veteran who served throughout the entire war. First, he was an officer, junior grade officer. He never made it past lieutenant, but he served in the 24th Massachusetts Infantry and the 3rd Massachusetts Cavalry for the duration of the war. He was from a wealthy family, a prominent family. And after the war, he seemed to do okay. He went back home. He became a florist. He opened a flower shop. He got married. But then things started to slowly unravel. In 1874, he decided to move to California to be a farmer and then maybe to speculate in real estate. Gradually, his inherited wealth started to fade away. He was unsuccessful at things. And after he failed at these ventures, he came back to Massachusetts. And by this time, his wife was really worried about him. He was exhibiting wild, unpredictable emotional changes, sometimes seemed listless and dead to the world. And he was not ever during the war significantly injured himself, but certainly he witnessed lots of death and lost lots of comrades. But you can see that like this didn't happen until 15 years after the war. It was not something that maybe they even connected with it. It was so much later. He basically descended into poverty, came from this wealthy family, used up all his resources, couldn't get employed anywhere because of his emotional problems. And finally, he was admitted to one of the insane asylums in Virginia, although that was more focused on disabilities in general. And when they realized, gosh, we can't handle this guy. I mean, he's just so lost and his emotions are so crazy. Like we're just going to have to. And so he was sent to St. Elizabeth's a couple of years later, where he spent the last 5 years of his life. So kind of a sad story, but not an uncommon one. Both in that he seemed to adapt well initially, but then later on in life seemed to descend into mental illness. We don't know anything about whether there was any mental illness in his family in particular, whether there were any predisposing factors besides the war, but so he's sort of an exemplar, though, of the types of soldiers who ended up at St. Elizabeth's. So in terms of African American veterans, this is a story of a private who joined so African American regiments were strictly segregated, except they had white officers mostly. But so he was in the 115th U.S. Colored Troops, so the USCT. That was in the last year of the war. He did serve in the Petersburg campaign and the siege, and he was actually his regiment actually was able to occupy Richmond when the Confederacy fled. And he was there when Abraham Lincoln actually came in, sort of famously. I mean, you never send your president in right after you'd won like a battle and the war wasn't even over. But Lincoln showed up as soon as they occupied Richmond. He walked around. They got to see him and meet him. And then he was discharged from service, like in 1866, as they were demobilizing the army. He went back to Kentucky. He was a farmer and briefly was trying to better himself, went to college. But then because either college didn't work out or he re-enlisted. But then something about getting back into the army triggered kind of a detachment, mental illness, began to experience paranoia, hallucinations that his comrades were after him. Initially, they said, "Oh, he's probably got syphilis," and this was uh, it was most likely a misdiagnosis. We have no way to verify this, although other observers say that no, there's no evidence that he had a sexually transmitted disease. This may have actually been racial profiling in a way, in that African Americans were sort of like assumed to carry syphilis more. Um, and he actually ended up at St. Elizabeth's, although that was very unusual. Only 50 African American veterans ended up at St. Elizabeth's, even though 100,000 served in the war, compared to 2,800 white Union veterans. This was thought to be partially, well, there are probably many reasons for this, but partially that there was some bias against African American patients. There was maybe less discovery of illness, less connection to treatment. Um, but he ended up there and basically lived the rest of his life there as well, which another story that ends kind of sadly. And there was similar on the Confederate side. So, but unlike the North, there were actually decentralized. So there wasn't like a main government sort of supported mental health care institution. There was just like each state had its own. Confederacy was all about states' rights, and that went for health care as well. And compared to Union veterans, Confederates were, had worse nutrition during the war. They lost the wars. They had to, rather than going home victorious and having a victory march through DC, like happened with the Union, they often kind of straggled back into their towns, and the towns were destroyed because the Union, most of the battles have been fought down there, and many cities have been destroyed intentionally by the Union in order to end the war quicker. And as you might expect, there were high rates of firearm suicide and assault. You send guys home with weapons, and sometimes they turn them against who they believed to be sort of who they blamed recently enslaved people. There was a lot of alcoholism. Alcohol was one thing that there was no shortage of, even though there was a shortage of a lot of other things in terms of living standards. Interestingly, Confederate physicians, for whatever reason, it may have been just because they understood that losing the war kind of had added an additional element. They were much more willing to say, yeah, this soldier is suffering a mental breakdown because of the war. It's due to the war, rather than in the Union, there was just more of a reluctance to do that, and to say, well, this isn't really connected. Um, the Confederacy, also a larger proportion of their white population served in the war than in the Union. That may have also played a role in that you couldn't really escape this, that every man sort of came back between the age of 17 and 50, ended up serving in some degree. So there wasn't a larger pool of men who were unaffected because they had never served. So what happened like later on? So I really like this study. What they did is they unearthed these pension board records. So every person, at least on the Union side, got a pension if they could prove war service and some health connection to it. And they had these standard medical examinations that we performed over the course of years. And what they found out, and they linked these records to active duty records, and they found that the higher percentage of your company that died, and that could have been in battle, or it could have been just they died of cholera or something, some camp illness. But the higher percentage were associated with higher personal risk to that soldier of post-war cardiac disease, gastrointestinal disease, and comorbid, quote, nervous disease and physical disease, which happened a lot. So even here, you kind of see there is the impact of mental illness, of trauma on these diseases, which we still consider mostly physical, but obviously, especially with cardiac and GI, there are connections to irritable bowel syndrome, and unexplained cardiac chest pain can be related to trauma. They also found that younger recruits, and younger meaning teenagers, basically, were much more likely to die early of anything than older enlistees, when controlled for their age. So their younger recruit might live only 10 years afterwards, and an older enlistee might live longer. And the greater incidence of nervous and physical disease. This may be also because, like, the younger recruits were less able to cope. They were still in the in their peak phase of brain development, and they're being exposed to trauma. So it's very interesting findings. It's the best that we can probably do at this point, because there weren't modern physicians around to diagnose people super accurately. But this definitely suggests that there were some long-term health costs that lasted well into the turn of the 20th century. So PTSD in the Civil War was called sometimes soldier's heart. It was or called melancholy, which is synonym for depression. In World War I, it was called shell shock. And in World War II, you have combat neurosis. Vietnam, it's called battle fatigue. And it wasn't until after the Vietnam War it ended, 1980, where there was the first formal criteria for this new mental condition called post-traumatic stress disorder. And I don't know how many of you are physicians or psychiatrists even, so some of this is maybe very elementary, but I wanted to talk about that. And I have an image here of Kristen Hanna's most recent novel, because I just finished reading it, and I think it's one of the heroine of the novel is a battlefield nurse who never goes into combat herself, but obviously sees a lot of horrific things and suffers from PTSD afterwards. And I thought it was just a very true to life, even though this is a fictional portrayal, but portrayal of what PTSD does to people and how it can hit you many years afterwards, and how difficult it is to work through, especially during this time when there was no diagnosis. And women who have suffered from PTSD would show up at a VA medical center, and they'd be like, "You weren't a soldier. Like, how could you have any problems? Go back to your life, have children." And it was also a very sexist time. So we think the lifetime prevalence, now obviously this includes all kinds of trauma, childhood trauma. It is more common in women. We don't know if that's an underreporting thing, but the lifetime prevalence is pretty high, and in Vietnam War veterans, it was very high. But even among people who are exposed to traumatic events, some people have more resilience than others. That 70% will either not report symptoms, or they just won't have any symptoms. And there are obviously a lot of things that, if you're a primary care physician or in mental health care, that can trigger this. There are a long list of diagnostic criteria, but what they basically boil down to is you have to have either a traumatic exposure, or maybe you're indirectly exposed through somebody else. So maybe um, you're not the person who experienced the trauma, but a close loved one of you experiences the trauma. And you have to have at least some of these symptoms, intrusive symptoms of flashbacks, re-experiencing, avoiding things that tend to trigger it. So maybe, like, you avoid loud noises, because whenever you hear something loud, a firecracker or something, you think it's a mortar coming down, and you're jumping for cover. Alteration in mood. So this is not just about these individual responses, but it's just overall, you just feel lousy, like you may feel depressed, or you may feel anxious all the time, not only when you're having direct reliving of the exposure. And you have this altered reactivity. You can be hyper vigilant, you can be hyper aroused, you can have the startle response, where people are like, "Hey, like, you totally freaked out when that happened," and it's because, like, even if the person's not consciously remembering, something in their subconscious is triggering it. So to be diagnosed with PTSD, symptoms have to last for at least 1 month and cause clinically significant distress or impairment in functioning. And the patients themselves may not even recognize what's going on. I mean, if you don't go to medical school and you're not in the army, I mean, you may not be exposed to what is PTSD, like what's going on. And they may not want to even talk about the event. You may feel you're treating this patient that, gosh, something happened to them, but they're either they don't want to talk about it, or maybe they kind of blocked it out. They don't even really want to remember it. And what makes this presentation sometimes confusing is that patients self-medicate. They may abuse substances in order to kind of get away from this. They may abuse alcohol. They may have other mental health conditions that are confusing. Maybe they're already depressed, and this is something on top of that. But there is a lot of comorbidity between PTSD and other conditions. You can see here, like the vast majority of people of all genders have PTSD. There are some patterns that we see. We're not sure, the rhyme or reason to that men seem more likely to develop certain things. And probably the most important thing, because you can't treat a patient if they're not alive, is that many patients will attempt suicide with PTSD. That's got to be one of the first things that we look at and treat. And so the suggested treatment, in addition to assessing for suicidal ideation, is education. It's important for patients to have a social support group, whether that's something that's created by a healthcare system or whether that's something that's a separate patient support group. The most effective treatment is probably trauma-focused psychotherapy, of giving ways patients to deal with the fear, manage the anxiety when it inevitably comes up. But there's also a big role for pharmacotherapy. Obviously, these drugs were not developed until the 1990s, so they weren't available to anybody in any war, up until probably the Iraq War. But SSRIs, and a few in particular, are useful. Many people will have sleep disturbances, and there is actually an older drug that can be useful for that. And many of them, for some reason, have obstructive sleep apnea. And what that does is it leads to chronic kind of fatigue because you're not getting effective sleep and your brain probably is not able to process things. And if you treat sleep apnea, it often will improve PTSD independently of these other therapies. So it was kind of abrupt ending, but I wanted to give people a chance to ask questions, and I wanted to kind of end with on the positive note that this is very treatable these days. And if you recognize this in anyone, whether they've been in war or in the army or soldier or not, that there definitely are resources, and they should first see their primary care physician, their family physician, to be assessed and decide if they are experiencing this or some other mental health condition.